From cleaning up after the flooding caused by Ulysses, there are also a number of health concerns we need to watch out for.
Now, among them are communicable diseases that may be transmitted through murky water.
Yun nga pa, ang problema rin kasi people are submerged in floodwaters trying to move around or reaching out to help others.
That's right. No, that seems to be the problem. Many people, sadly, don't really have a choice. And then, of course, everything is contaminated. And with that, we would like to bring in Dr. Kenneth. Now, he is the National Chair of the Philippine College of Physicians Crisis Preparedness and Management Committee. Good morning, Doctor. Thank you so much for being with us. Now, you heard our intro earlier. Now, what are these communicable diseases that happen during situations such as this? And how can we even protect our families? Because in certain situations, talaga, no choice talaga, di ba? Kailangan sumabak ka talaga sa tubig.
Good morning, Christine and Paolo. The most common diseases that will occur during flood, which we are experiencing right now in the Upper Luzon region, are waterborne disease, then influenza and leptospirosis, and vector-borne diseases, which will come next, dengue fever. So right now for waterborne diseases, as have been discussed earlier, we really need clean water because diarrhea, cholera will come in, especially if the water are contaminated. And what we are afraid, because I'm also a nephrologist, the leptospirosis. So we have already coordinated with our chapter presidents in Northern Luzon, Upper Northern Luzon area, that we have to start giving prophylaxis for leptospirosis. So they have already been informed, and it's already our practice to give leptospirosis prophylaxis for those who are wading in floodwaters. But the advice really, if it is not very important to wade in floodwaters, we really have to avoid wading in floodwaters. So we're really afraid of waterborne diseases and vector-borne diseases. And if those people are in the evacuation centers, upper respiratory tract infection, influenza might occur because of the crowded evacuation centers.
All right, Doc. Now you've already touched on it. The situation in evacuation centers, is quite dire. We live in a fairly well-developed area, but still, we also experience a little bit of water problems.
Yeah.
Over the last few days. Among that is, aside from getting in the water and wading in the floodwaters, is ingesting water. I know the water quality does suffer when you have weather situations or heavy flooding like this. You touched on diarrhea, other diseases that may come from ingesting water that is not very clean. Is that something that we should be concerned about?
Most of the time, it's always gastrointestinal diseases or diarrhea. So we really have to make sure that the water is not contaminated. So we have tablets to purify water. So we can send water purifying tablets, or we have already portable water cleaning or water distilling machines so that they can be provided with clean water for diarrheal infections.
Okay, and now, Doc, of course, we're in the middle of the pandemic, and we've always talked about social distancing and once you're in the evacuation centers. But we all also know how difficult this can be, because once you're there trying to survive and trying to escape, the flood, it's like from the floodwaters, you jump into an evacuation center where it's not over. Parang you can still get a lot of these diseases. Ano ba, Doc, how can we even practice social distancing in evacuation centers?
The first thing really is prevention. So what we advise really our evacuation center managers is to identify those who are going into the evacuation centers if they have respiratory symptoms or not. So if they have already signs of respiratory symptoms, they should be separated from the group so that they will not infect. And for those who are inside the evacuation centers already, it is advised that they report immediately if they have respiratory symptoms because of the present pandemic of COVID. We really cannot, social distancing is very important. And we have to advise the managers of the evacuation centers to advocate or reinform, or um, they let their people in the evacuation centers wear the mask every time, always, so that they will not infect others. And once somebody has respiratory infection, it should be it is needed that they should be separated from the group, so that there will there will not be having cross infection inside the evacuation centers.
That's right, Doc. Now, I think everybody wants to lend a helping hand for those in need. For those who do want to help and donate, what are some of the things that evacuees need most? Obviously, shelter, food, those are top of the list. But obviously, you talked about water purification. You talked about creating safer conditions in rather cramped conditions in these evacuation centers. What are some of the things that we may not always think of?
Pardon.
What are some of the things that we can do to help our brothers and sisters in these evacuation centers?
What we can do really is we ask the evacuation managers what they really need. So right now they need, the most important thing is potable, clean water. So it depends upon the centers if they can get water or they can get purifying machines to provide clean water for the patient, or they can use the water jugs that we put potable water into. And we advise the people that they should not use one cup for everybody. They have to have, they should not share utensils or cups, so that they can avoid cross infection amongst them.
Okay, aside from water, Doctor, briefly, before we let you go, we do want to find out, as we prepare to send care packages sa lahat ng mga lugar that would need. Sometimes we overlook, let's not send this because hindi naman talaga kailangan. Sabi mo, aside from yung tubig, ano pa yung mga necessities, mga kumot ba, mga hygienic kits that they would need? Ano pa yung talaga yung mga essentials kung magkakaroon ako ng isang care package na kailangan talaga natin ipadala?
The essentials really is for us as medical practitioners. We should be prepared to give medicines for prophylaxis, especially for leptospirosis. And we should also be prepared to have medicines for those gastrointestinal diseases. So it is very important that we coordinate with the evacuation managers so that there will be no redundancy or repetition of what they really need. Because right now, it's very essential and very important that we know what they need so that we can provide what they need. Because if we will not be doing that one, there is a possibility that there's redundancy on the relief goods that are given. So what we notice as medical practitioners, there's before this Ulysses, like Usman last year, we had already coordinated with people in Bicol and Catanduanes regarding the preparation of doxycycline for prophylaxis in leptospirosis. So right now, Upper Northern Luzon chapter has been prepared. Bicol has been prepared already. Unfortunately, they lack supplies. That's why we are, as PCP, we are sending doxycycline to them so that they can provide more doxycycline to the people in those areas.
Okay, wonderful. Thank you so much.
So we really need medicines right now, but we have to coordinate with the evacuation centers, the Office of Civil Defense, what they really need. And right now we are coordinating with different chapters of the PCP, what their community really needs right now.
Wonderful. Thank you so much, Doc, for those tips. We'll keep that in mind. And thank you so much for your time this morning. Once again, that was Dr. Kenneth Koo.